Hey guys, welcome to Couch Conversations with the Doctor's Road Show. And for those who have seen this platform that Danny Davis has given us, we take this moment to pause and answer questions, health-related topics that will allow you to be healthy. So we do this every Monday night, and Nikki Harvey has asked me to help host this version of the show tonight. Looking forward to answering questions. So as we start our conversations, go into the comments section and ask any medical questions that you have. We'll get the conversation started, so no worries. But before we do, I want to make sure we get a chance to introduce all the panel members so they can get a chance to chime in and share their background. So let's go ahead. Now, I think I'm going to start with the gentleman below me, which is Dr. Graham. Why don't you go ahead and introduce yourself, Dr. Graham?
Yeah, thank you, Charlie. I'm a retired physician. I spent about 30 years working in the Chicago area. 2 years ago, I joined the congressman in his office, working on healthcare issues. It's an honor to be on this panel. I'm going to try and answer your questions if I can.
Excellent, and I appreciate that. And let's slide on over to Dr. Miller. Would you introduce yourself, my friend?
Yeah, good evening, everybody. I'm Dr. James Miller, an internist who have retired from clinical practice in 2019, but still interested in healing our community. And I'm here to do whatever I can to answer questions and hopefully help the healing process.
Perfect. Thank you, Dr. Miller. Dr. Mason, why don't you introduce yourself?
Yeah, I'm Dr. Terry Mason. I'm a retired urologist, retired in 2006, and then spent a good part of my rest of the career in public health, both as Commissioner of Health for the City of Chicago and Chief Medical Officer at Cook County and Interim Chief Executive Officer. But we've had a great ride, and I've been grateful to God for what he's allowed me to do. And I look forward to answering your questions to the best of my ability tonight.
Excellent. Thank you, Dr. Mason. And Dr. Pete, why don't you introduce yourself?
All right. I am Dr. Pete Thomas. I'm a general internist. My passion is men's health, preventive medicine, and public health. So I'm happy to be here and share and keep our community healthy and learn a lot from this dynamic panel that Congressman Davis has put together.
Excellent. So thank you. And of course, before we introduce the esteemed congressman, I'll just make sure you know I'm Dr. Tony Hampton, a family doctor, an obesity doctor, a doctor passionate about metabolic health and achieving it. And I'm always happy to share whatever I can share with anyone who's willing to listen. The keys to achieving metabolic health. And metabolic health is about reducing blood pressure, keeping your blood sugars normal, having a waist that's not too wide, and making sure your triglycerides and your HDLs, that's the cholesterol numbers, are normal. So I'm always going to work to achieve that. And part of that is to reach out to the community. You have to do a grassroots movement. You have to go to the people, because sometimes the busy doctor is so busy that sometimes the way we're trained, we're not taught to focus on wellness. So we're trying to make sure you know what that is, so that you'll know what to do. You'll know how to eat better, how to exercise better, et cetera. So happy to have you. And while I'm talking, I'm thinking about my congressman. So the esteemed congressman, please, not that you need an introduction, but make sure, let's introduce yourself and then let's start our conversation.
Well, given the fact that they're all males on this panel at the moment, I'm going to mention two African-American female physicians that I've had the opportunity to work with, both who were pioneers. Dr. Effie Ellis, who was one of the premier children's doctor in America. She was the first African-American to become an officer of the AMA. She was vice president of the American Medical Association, and she pioneered child health legislation. And she also pioneered African Americans becoming actively engaged in the American Medical Association. A few years ago, when I got involved in health, when I first got involved, nothing happened legislatively or hardly programmatically in medicine unless the American Medical Association sanctioned it, thought it up, approved it, or whatever. I mean, they were the giants of American medicine in terms of decision making. And so that was Dr. Effie Ellis. The other one I will mention is Dr. Helen Retta. Right now, we have health maintenance undergirding and being the system that takes care of many low-income people and the low-income populations of America. Dr. Helen Retta was a pioneer in that thought process because she worked for the Office of Health Maintenance Organization Services of Health, Education, and Welfare. Both of them are deceased, but they are indeed outstanding Black medical professional females who helped chart the course for health care, not only in Region 5, but throughout America. And so I would just thought I would mention them. I'll also mention a male, Dr. Leonidas Berry, because there have been, I've been fortunate to meet, know, and interact with some of the most outstanding physicians in the world, not just in the United States of America, but in the world. When I think of the Rehabilitation Institute and what it's able to do, Shirley Harris, their medicine has advanced so much, but Shirley Ryan Rehabilitation Hospital, they do just incredible things in rehabilitation medicine. And so it's been my pleasure to meet, interact with some of these people, and to tell you that if they say you ought to do it, like wear your mask and stuff, they pretty much know what they're talking about. And they're not trying to lead you down a primrose path. You better listen. There's a guy named Gator Bradley, and at many of the places where people are, when they be saying something, Gator will say, "You better listen." You better listen. And I think we better listen to the doctors. So thank you.
Well, thank you, Congressman. Your comments are well received, and you provide such perspective. So I really appreciate you and appreciate your comments. And I think we'll start our conversation. And I want to kind of start a little bit with us talking about prevention. And I'm going to allow my brother Pete to comment, but before he comments, I want to think about, I want to share, my experience with getting a colonoscopy as well. And I remember, I think I kind of went past the age of 50. I think I was around right before the pandemic, actually. So I kind of got it in before the pandemic. Things kind of shut down.
Right before the pandemic, actually.
Within our system, things kind of shut down. And what I ended up doing is it was such an interesting experience because I didn't really know what to expect. But the good news is it wasn't nothing that I expected. It was much easier than I expected. I mean, the worst part was really the prep, and it really wasn't that bad. I remember, I don't know how your experience was, brother, Pete, please share, but I'm gonna tell you, I think I took some medicine at 5 p.m. and I'm thinking, oh, this ain't nothing. It's no big deal, you know? And somewhere between 7 and 8, things got crazy. And I think I spent several back and forth to the bathroom as my body was preparing to give my doctors a clean visual of what they need to see. And thankfully, somewhere between 11 at night or 12, I was able to get some sleep. And then I woke up and went in for my procedure. And quite frankly, I was, literally was like, hey, count backwards. And they kind of put me to sleep, not a deep sleep. And it seems like immediately after that, I was waking back up. But, and then I think about all the people who hesitate to get a colon procedure. They kind of, in your brain, you make kind of a big deal out of it. You tell yourself that this is going to be a very difficult experience. But the reality is it was literally just, preparing your body. And the procedure itself was a walk through the park. And it was just much easier. So, man, I think about the people who miss out on this opportunity. And really what it is an opportunity to not just, screen for cancer, right? This is true cancer prevention, because if you have a polyp in your body that needs to be removed and you remove it, you didn't screen, you actually removed a future cancer. That's a remarkable thing. And there's very few things that we can do in healthcare where you can literally go in and literally treat something in advance and prevent you from catching something. And it's just amazing. So you just don't want those precancerous polyps to linger. So I'll end with that. I just wanted to just share my perspective, which was it wasn't that bad. And I'm really excited that we have an opportunity to hear others. So Brother Pete, why don't you share your experiences? Yours is more recent than mine.
Yeah, absolutely, Dr. Hampton. Mine was this morning. And so, yeah, much like your experience, now, mind you, I've been ordering colonoscopies for my patients for 20 plus years. This was the first time, and I'm observing the whole experience, from the nurse taking my information, COVID data, to making me put on the robe, the little gown. And I'm like, we haven't gotten something more secure than this. You ain't got nothing in the back. There's nothing in the back. What's going on here? But it was a surreal experience because I'm looking at it from both perspectives. One, now I'm the patient, and I used to write for these and order in the computer, and it's done and it's out of my hair. But so kudos to all my patients that believed in me and believed in the time and information that I had to give to them. But yeah, so the prep was real, okay, as it should be, because that's where all the money is. If your colon's not completely clean, then the colorectals and GI guys can't see what they need to see in order to remove what they need to remove, if anything. So, and I remember when the colorectal guy was talking to me, he said, we're going to look for anything that looks suspicious. We're going to take biopsies of anything, take it out if need be. So the phrase that came back to me from when I was in medical school is that all polyps are not cancerous, but all cancers come from polyps. And so if there is a polyp that looks like a pea or looks like a little cauliflower, they can take that thing out. And like Dr. Hampton said, that removes that risk for cancer. Now, we also know the ultimate treatment modality or prevention modality is a change in your behavior, right? So that behavior change that predisposes that polyp from being there is where all the money is. But kudos for my patients who have been there. It was like Dr. Hampton said, it was wham, boom, bap. By the time they gave me the Versed, the medicine that makes you sleepy / a little whoopy, or loopy, it's over with. You feel a little pressure in your belly, like pressure, like you got to poop. But beyond that, it's not a lot. And then by the time you realize it's over. He actually showed me the polyp that he wanted to remove. And I have a follow-up appointment to see what the cytology is for that. He told me he didn't think it was cancerous. But again, another teacher told me tissue is the issue if cancer is the answer. So until you get the tissue sample back, don't claim it, because if cancer is the answer, tissue is the issue. So you got to get the tissue sample, and we'll see what that says. So y'all keep me in your prayers and things of that nature. But I am reminded that the Milken Institute said that right now, chronic disease will account for $1.8 trillion in healthcare costs in the United States. And so as we come out of this COVID pandemic, oh my goodness, how much will we have to deal with in terms of uncontrolled diabetes, people missing their mammogram appointments, colonoscopy appointments, uncontrolled high blood pressure. We have our hands full when we're out of this pandemic. And so that's why I've been doubling down on my patients in terms of making sure that they are paying attention to just more than just, COVID. And so I'm curious to know from other people what their experiences were getting their screening tests. And, it was my first time ever having anybody in that kind of private area. And it was an experience. Thank you, Lord. But I'm over it.
It's interesting when you got young people on the panel, like Tony, Dr. Hampton, and Dr. Pete. I'm not saying anything bad about the rest of us, but they talking about this is their first. It'll be my third.
Oh, wow.
Okay. Because I had one at 50, I had one at 60, and now I'm having one at 70. So it's really, and I would agree with them, it's a very important thing to do. And I will always say, like you said, Dr. Hampton, the most difficult thing about it is the prep. You got to clean all the crap out, literally. And you'll get medicines to do that. And that's what the job is. So you don't plan on going anywhere. Don't plan on going nowhere but to the bathroom. That's what you got to plan on, because that's the only place you're going to go. And they used to have a thing called Go Lightly, which made you do anything but go lightly. You went a lot. And if you were FOS when you started, you won't be when you're finished. So it is important to do that, because if the fecal matter is in the way, they can't see the walls of the colon. So you've got to have, when you get toward the end of the prep, it ought to be almost like water coming out. And that's important so that they can see well. So it's important to do that. But I just want to add one caveat. The colonoscopy won't prevent anything. The colonoscopy's job is not to prevent anything. The colonoscopy's job is to find something early so that a technique can be used to either to take it out or to do other kinds of resections in the hope that we can cure cancer if it's there. So I don't want you to get it twisted, as the young folks say. This is just something to help look to see. And the key that if you want to make sure you don't, there are a lot of things we've talked a lot about on this show that will help prevent you from getting these things. But you need to understand that if You know, we're a group of people that are full of feces. Many of us do not have bowel. If you're eating 3 times a day and going to the bathroom 3 days a week, you're full of it. You need to really rethink your situation. And I know we have people here who can speak on that, but really, you need to have, if you're eating 3 meals a day, you ought to at least poop once, you know, at least once, if not more. And theoretically, if you like your babies, you'll poop every time you eat. Little kids, that's what babies do. So many of us who are not having bowel movements on a regular basis, that's a setup for a problem, potential setup for a problem. And it really means you're not eating enough food with fiber and you're not drinking enough water. And fiber only comes out of stuff that comes out the ground. If it walks, hops, crawls, swims, got eyes of mom and a daddy, it ain't got no fiber. So you got to get food that got fiber and you got to drink water. And those are your preventive measures. And I'll stop there.
I'm along with Terry. This is my third. I'm scheduled for my 3rd trip. But indeed, it's really in terms of the patient. It's an easy ride. The only thing that you have to do that you may feel a little uncomfortable with is move your bowel, and but there's no pain involved. There's no other kinds of things that you have to be that concerned about. Just follow the instruction, take the medication so it cleans you out, so that because if you don't get clean, that means you got to go back and redo it. And so you don't want to have to do it over. So, once every 10 years is enough for me. So I tried to make certain that I followed the instruction and recognize, as they said, that if you've done what should be done, by the end of the time, the only thing that you're seeing is something that looks like water. That means that you're clean of feces, and they'll have a good look and be able to see the walls of your bowel, of your colon, and therefore able to recognize if there are growth there that should not be there, and to be able to remove those things, and to determine if they are situations that are pre-malignant or even malignant at an earlier stage than catching something after the process has developed into something more serious and requiring more treatment and more interruption with your normal activity. So there's nothing to be afraid of in terms of the colonoscopy. And it's again, it's not something that I really want to do, but it's something that is needed, and I didn't really, like I said, have a difficult time with it.
You guys are playing catch up. I've already done it. I've always been scared, but the only thing that I really got was a feeling of relief every time in terms of feeling when I got the report. I mean, I used to have gastro problems. I mean, there was a point when I used to have them, and I don't think I've had any in about 10 years. So I don't know if I'm improving, or I think I even had an ulcer one time. And yeah, I used to, get treatment for an ulcer. And I don't think I've had that in about 10 years. So something is working.
There you go.
So I do want to just briefly comment that we use an organization called the U.S. Preventive Services Task Force to give us guidelines, and it's important that you understand the guidelines are just what the word says. It gives clinicians guidance. And the reason why they give us guidance and not firm rules is because we have to be able to individualize our care so that people are able to make different decisions based on the particular situations that's in front of us. So for cancer screening, even just within the last week or so, we've been been privileged in my organization with Advocate of Rural Health to put out a memo saying we're going to start at 45 instead of 50. Now, you may not know this, but for communities of color, we were already at 45. So now we're saying for the general population, we're going to start earlier, because what they're finding is that if you get the screening done earlier, it'll absolutely be a benefit. And we generally go all the way to 75. However, if you, the way I look at it, if I have a person in front of me who has a life expectancy that's greater than 10 years, we may want to take that person and also do some screening for that person as well, all the way through 85. So it's really just a great opportunity to take advantage of some screening that may save your life, and so you'll be here for your family. Another screening that we should probably touch on is prostate health, since we got all these guys on the panel tonight. And so if I were to ask the U.S. Preventive Services Task Force about that, they would also recommend that we have a conversation around getting a prostate evaluation, rather it's a PSA, which is the prostate specific antigen. And we start that test. It depends on your situation, but I would say somewhere around 50 or 55, you want to go ahead and start thinking about that test. And that includes whether or not you should get a prostate exam. So this particular test is really important that you talk to your doctor, look at risk factors. If I have a family member who had a prostate cancer issue at an early age, I may want to start to screen myself earlier to make sure that I can reduce my risk. So let's think about the prostate, guys. And so many of us don't want to go in for that. It's a violation to go and have somebody check my prostate, and certainly the lab is much easier. But I'm curious to hear what my colleagues, my more seasoned colleagues, what would they say about getting a PSA or a prostate exam?
Well, I guess since I'm the urologist, the retired urologist on the panel, that sort of falls to me. But I think that the recommendations have changed. And I think that you discuss those with your primary care physician, but do bring it up even if they don't. Do bring it up, particularly once you're past, some people say 45, certainly by 50. And the screening is done in two ways. There's a rectal exam, and I can tell you that the rectal exam is not very sensitive for picking up prostate cancer. It's just not. The other test that they do is a blood test called the prostate specific antigen, which looks for something that's in the blood that comes comes from the prostate and can be quote unquote elevated when there is a tumor or cancer in the prostate. But you also could have just a big prostate too that could create this same situation. So the thing is, and I think the takeaway, Dr. Hampton, is always have that conversation with your primary care doctor. And you could always ask to be referred to a urologist at the time that it's appropriate for you to do so. But I want you to remember that early detection is just that. Early detection is not prevention. So I don't want you to get them confused, because many times we do. So we want prostate cancer screening falls in that early detection, the tool that's used for early detection. Why? Because we believe that if we find something and there's not a lot of cancer there, we got a better chance of doing something about it than we do if we get a lot of cancer present and it's spread outside the prostate gland, because you can't go by how you feel. Let me just say one thing about everything. There is no symptom. Let me say this 3 times. There is no symptom. There is no symptom in the earliest, most curable form of any disease. No symptoms. So if you're that's like waiting for your tailpipe of your car to fall off the muffler to fall off before you take it in the mechanic shop or make it a lot of noise. That's why it's important to have a primary care physician who is going to use, as Dr. Hampton already said, the appropriate guidance for what screening needs to be done. and do that in the appropriate way. So just remember that early detection is not prevention. Early detection is finding it early. And prevention is a whole nother conversation that we should have. We'll take some time later on to talk about that. But prevention is something that you have to do. And that has to do with what you eat, how you sleep, and a number of other things. So, and what you drink. So I'll stop right there. Dr. Hamilton, does that answer your question?
Absolutely.
I can jump in one thing and say, and I agree is that most people don't like having a rectal exam. But I will say, going to make this point, that over my years of clinical practice, that I found several situations, several rectal cancers in patients that were not of age in terms of having a colon screening test done. But some of it was men who had some issues with their urinary tract, or either evidence of an enlarged prostate. And during my evaluation, that would via rectal exam, I found a mass in their rectum. And this is not just a one-time thing. It happens several times. And so, like I said, a rectal exam is an uncomfortable thing for most people, and it's not something that people like. But however, there are diseases that can be detected, and given the age of these individuals who probably would not have had a colonoscopy for another several years, 2 or 3 years, which means that by that time either they would have had symptoms maybe, but they had not had symptoms up to that point. But the disease may have been very far advanced had not we found it on a rectal exam.
Very good point. And I just think that I'll always remember the couple who came to the office, a new couple. And he said, "Man, I don't know why she got me up in here." And he was no more than about 52 years old. And I said, "Well, I think that you may have picked a good partner, and because I think you should get these screening tests." So he was no more than, like I said, just above 50, just started dating, 6 months, had his colonoscopy, and what did they find? Colon cancer.
Wow.
So I said, "She's a keeper." You may want to hold on to her because she may have just saved your life. So he was successful in getting treated and was able to take care of his colon problem. And I'm just so thankful that we have strong women in our lives.
Dr. Hampton, what was the blues singing that said it's cheaper to keep her? Cheaper to keep her.
Johnny Taylor.
Cheaper to keep her.
That's right.
I can just as a primary care doc also testify that a lot of my male patients, when I was doing Project Brotherhood, the men's clinic, I mean, the women in our community drove that clinic. And I think, outside of the one of my mentors, Dr. Linda Murray, I mean, they really drove that clinic in terms of the men that came there. It would be their wives, the sisters, the aunts, the nieces that heard about the program and said, "I'm bringing my uncle, I'm bringing my brother, I'm bringing my dad, I'm bringing my husband." And I think women have just a unique ability to not to be afraid of things that they don't know. And so they made sure that the men were in there getting those screenings and following through. So the one thing is, because as we all know, we can order that test, right? We can order the colonoscopy, we can order the PSA, we can order all these things, but it's another whole thing going through it, following up with the GI doc and going to pick up the prep, the Go Lightly that Dr. Mason talked about, taking the Go Light. So there's a whole process, and all of that we largely depended on the women in our lives to help support us, to say, hey, because even with my wife, she was making sure I wasn't eating nothing. She was like, well, wait a minute, that ain't on the Did you read that on the package? Then put that down. Okay. And I'm a doctor, but she was making sure that I was being true to it, because he's like, because you don't want to do this again if you don't need to. So if it say no color stuff, no nothing red, no nuts, no seeds, then you got to do what you need to do just for that 48 hours right before your screen, right before your colonoscopy. But I'll also say about the prostate specific antigen test, since the most recent guidelines change, that we have noticed that we're finding more advanced cancers than we did prior to that guideline change. Mm-hmm. So I do think that although the guideline change did recommend or had a unfavorable response to getting the screening test, but I think you need to talk to your primary care doc, and more data is better than no data. Okay. Or less data. More data is better than less data. Less data is better than no data. And so, yes, putting your finger in the butt to feel the prostate is not as sensitive or accurate, but that's some data. Yes, getting a PSA is not a foolproof method of screening, because your PSA can be elevated for other reasons other than cancer, but that's some data. And with the combination of all this data, you can make a decision that, okay, your PSA is 20. I've never seen a PSA 20 and don't equal cancer. Now, if your PSA is 10, that's a difference. That might be this or that. But I'm saying a 20 PSA, that means you're taking a trip to go see Dr. Mason, and I'm going to let you and him discuss what should be done at that point. My preference would be walk away with a biopsy, because again, like my former teacher used to say, if cancer is the answer, tissue is the issue. I don't lose for a biopsy. I don't lose. That's what I tell my patients. We don't lose. If you walk out of there with a negative biopsy for cancer, kudos to you. Now, it doesn't end there, right? Because we need to change our lifestyle to also decrease our risk for cancer. So it's not just, and I caution my patients about that. Don't be celebrating and going back to the bar and going back to the rib shack and all the rest of that. Now's the time. You got a negative diagnosis for cancer. Now, let's change your lifestyle so that you can reduce your risk for cancer.
I just want to add that the International Agency for Research on Cancer said that, and this is over 800 scientists worldwide, said that one hot dog or 4 strips of bacon increase your colorectal cancer risk by 18%. So we should know that. And unfortunately, we eat a lot of this stuff. Now, that just says increases your colorectal cancer risk by 18%. It doesn't say it increases you by getting to get cancer by 18%. It just says your risk. Yeah. And we need to be clear about what that is. And we need to understand what these things are. And we do need to eat better. And I used to tell the guys, I used to have a picture in one of my slides that all these places where these guys hung out, it was a barbecue joint, had all kinds of smoked meat hangings from the ceiling and all kinds of sausages and stuff like that. And I see, I had that picture there because these so-called manly places to eat are robbing you of your manhood, because it's creating an inflammatory situation that can lead to erectile dysfunction. So just be careful. Just be careful. And you don't have to be afraid. And the women, and to Dr. Pete's point, I think women get acculturated to having more frequent evaluations than men, because men don't have periods, so we didn't have a reason to go start seeing gynecologists as young people. And so here we are waiting to almost 40 years old before we start seeing someone specifically around prostate issues, if our primary care doctor that we should have significantly before that time is not doing it, and they should. So, it's good to have these good conversations, and I hope that you take away from these conversations that we're having things that you can use to help you live a healthier life, because at the end of the day, it's up to you. It ain't up to us. Our job is to make sure you get information that you understand, that you can use. But at the end of the day, it's on you.
Can one of my esteemed panel talk about the use of intermittent fasting? Because I think we talk about different food groups that help to protect us from inflammation. But what about intermittent fasting? And is there any solid, relevant data to support this practice in preventing inflammation?
Yeah.
I'll let Dr. Hampton go first, and then I'll comment after that.
Yeah, I think it's no doubt that intermittent fasting is a practice that many people practice, and when it comes to cancer, it kind of makes sense. One of the things that I tell people about intermittent fasting is that if your body is spending excessive amount of time digesting, right, then in fact, one study I looked at suggested that 60% of your energy expenditure for the day is spent on digestion. Think about that. So if I have that much of my energy being used for digesting food, then I only have 40% left to do all the other bodily functions, one of which is to protect you from cancer. Your body is fighting cancer the moment you're born. You're constantly, turning over cells, and if those cells are mutating in the wrong direction, you want to have a body that's able to identify those harmful cells and use a process called autophagy. Let's make the cells. We're gonna literally put something in the cell and say, we need to get rid of you, so we're gonna have you implode. We don't want you to explode. We're gonna have you implode on yourself and fade away. And then our body is smart enough to remove those types of cells. So the good news is that if you do intermittent fasting, you'll increase the chances that autophagy will kick in. And so what I tend to do, because I like to eat like everybody else, I'll do intermittent fasting, and I'll eat between 12 and 8 or so. And then only eat between 4 and 8. So to do the thing that it needs to do in terms of healing it, about us using something like intermittent fasting to not only reduce our risk for cancer, but also, what does your pancreas need to do? It needs to relax and chill. So if I don't eat, my pancreas can recover. I have had patients only do intermittent fasting, nothing else, and their blood pressure gets better. They haven't changed the medicine, haven't done any dietary changes like low carb or low fat. They just started doing intermittent fasting. Their blood pressure is better. And I can go on and on. When you're fasting, you increase growth hormone and testosterone. So not only do you not have as high a risk for prostate cancer, guess what? Testosterone is higher, so your desire for intimacy may be better. And we just want to do all these little nuggets, these little things to increase the chances that not only that we don't get cancer, but that we can optimize our lives so that while we're living, we can enjoy our lives in a way that maybe we otherwise wouldn't. So it's a very simple thing. It's cheap. It don't cost anything to fast, right? It's convenient because you can fast anywhere, right? So it's a very simple principle. And people who eat the wrong foods are like, who are grazing all day like a cow, they can't imagine not eating. But once you become adaptive, just like anything, your body will adjust. You will easily be able to adopt this lifestyle, and your mental clarity will go through the roof. Your ability to focus will go through the roof. And I can't imagine thinking about food like I once did. I don't think about food because most of the times I eat my lunch because it's time to eat lunch, not because I'm hungry. So I really encourage anybody that hasn't tried this approach to consider it, that the benefits is a list long, and it's really a great way to be healthy. So I'll pause there.
Well, I know the hour is late and we're a little past time. So I'll just say that, one of the things that we got to do before we get to intermittent fasting is stop eating all day. Many of us eat all day. We don't fast at all. We don't even fast in between meals, or allegedly in between meals. We're snacking in between meals. So we eat all day long. And I think that's, to Dr. Hampton's point, your body, yes, it's designed to be able to handle that from a physiological point of view, but the question is, should it? And the other thing that we don't do is we don't drink water. We don't drink nearly enough water. And if we drank more water, we'd probably eat less food. Because if you drank the kind of water that you really need to drink, you would really eat less because you wouldn't have the room. Obviously, it would get metabolized and you urinate out excess. That's one thing. And the other thing is, the other places we don't is that many of us are getting up during the night and eating then. I'm serious. We're getting up during the night and we got those trips. There's tracks to the refrigerator. And because now we've made food so convenient, you could throw it in a microwave and in 90 seconds or less, you could have a whole nother thing to eat. Not to mention that if you got a 65-inch or 50, 60-inch TV in your bedroom and you're an insomniac and you're watching television at night, you can see a 60-inch hamburger flash in front of you at 2 o'clock in the morning that you could call Uber Eats and bring it to your house. I'm just saying.
I hear you.
It is. I don't want to blame the people, but there are some structures in place that keep us away from doing the things that are healthy, and then even eating the things that are healthy. And I'll lead by this. Some interesting data in the paper that I read. It's not new, but they were talking about how the role that choline plays, and the transformation of choline in our gut, and how that and that changes by the kind of flora that we have. And most of us don't even know. And one of these times we'll talk about that. But the real job of your intestines, one of the real jobs, is to create the right bacterial environment so that you get the things that you need to help break down the food even better. Mm-hmm. And when you don't eat fiber, you don't have that environment for those. And we'll talk about this at another time. But it's really, really important. So that bacterial flora determines how some of the things in your body gets metabolized, gets changed or not. And one of these days, we'll have a conversation to talk about just digestion, just what happens and what different foods and liquids that we drink, how they impact on our digestion. And the most ubiquitous, I almost said poison, but one of the most ubiquitous things that we have that are around is sugar. Mm. And sugar, it's been shown that sugar, according to, I'm sure someone that Dr. Hampton, maybe others know, doctor in California was a pediatric endocrinologist, talks about how sugar activates the same receptors in the brain as does cocaine. Mm-hmm. So we need to talk about food at some point as an addiction, as a real physical, certain foods as a real physical addiction, so that we can then recontextualize intermittent fasting and diets. And I'm not going to use that term anymore. I'm going to start. I don't want to talk about diets anymore. I want to talk about livids. And I want to talk about things that causing people to die. I want to talk about things that help you live. So I'll stop right there, Dr. Hampton.
Well, thank you again. Any other comments, guys?
Well, I would just say that, when we, again, talking about, eating on a real frequent basis, everything needs rest. If you were on a treadmill continuously, obviously you would eventually just drop. And if we have our body parts working continuously without giving them the proper rest and from just digesting food and processing, the food substances into the areas that they need to go, then it's going to cause an overworking of that system. So obviously, not eating so much, not eating so frequently, not eating on a continuous basis there's a set amount of time that we should not eat, and we should allow some rest of our GI tract and allow it to recover from what it does normally.
All right. So, Nikki, I know you're the only non-male on the panel. So I just wanted to give you a chance.
We didn't hear from Dr. Graham at all today. Are you okay, Dr. Graham?
That's true. You don't want to tell us this interesting story.
Of course, Maya is enjoying her Valentine's Day on this Monday. But, Dr. Hampton, if we could just say thank you to B. Arrington, who's here, who says, thank you for the information. Susan Underwood is here, and she says, intermittent fasting has helped me so much. And I must agree with her, because intermittent fasting has really helped me a ton. I don't eat before noon, and I don't eat after 7. And if I do, I am sick at night. So yes, I have been doing that. And not only does it help me, but you see the inches falling off. Chris Thompson is here and says, absolutely. Janet Scott says, thank you for the information. Valdemir Talley, that's retired Chief Talley, says, this is very interesting that intermittent fasting can help lower your blood pressure. Are there sources you can direct me to for additional information? And absolutely, Chief, we will put some things in there for you, because my blood pressure is doing a whole lot better as well. Dr. Hampton says he will share this right after the broadcast. Tamika is trying to find her way here, Dr. Mason. She has inboxed me and says she's trying to find her Uncle Terry. Sister Bonnie is here and she's sharing and says, thank you for being back. Deacon Anthony White is here and he says, indeed, we can. And a lot of our church pastors are here just as well, and they're saying thank you for being back, and thank you, Dr. Hampton. So just wanted to share that with you and share some of the comments that are trending in here on the side.
Well, thank you, Nikki. And I know we're getting close to time to wrap up. I really thought it was nice to touch on men's health and the importance of a colon and a PSA and prostate exam if appropriate. There's other things that men need to do. We need to check our labs. There's so much information beyond a PSA that our labs will provide for us. And the thing that you won't believe, but it's true, I've seen it over and over again. If my kidneys are starting to behave in a way that makes me worry, I've never seen your kidneys improve. That's the microalbumin or the creatinine that we measure in the blood. I've never seen it improve with medicine, but I guarantee you, if you get on an anti-inflammatory diet, you stop eating processed foods, you eat real whole foods, and you drink plenty of water, stop drinking all that soda and all that sugar, you can literally reverse kidneys that are failing. But there's a time with that. If you get to a point where, you've really harmed them too much, there's a point of no return. But I've seen patient after patient do better, which means you have to have someone checking the labs. One of the labs that I want to throw out before we kind of get close to everybody sharing their final thoughts is an insulin level. Obesity and diabetes are prevalent, and many people are concerned about diabetes. If you get a fasting insulin level, it can predict your potential for developing diabetes 5 to 10 years later. So you can have a completely normal blood sugar, completely normal hemoglobin A1C. Because the body is a remarkable specimen. Because even when you give it the wrong food, your pancreas will work overtime to still keep your sugar levels normal, because too much glucose in your blood is very toxic to your body. So we'll know that that's happening because your insulin level will be super high. So if you've not had a fasting insulin level, and there's something called homeostatic test that you can do. And they can do a little calculation and determine if you're insulin resistant. And if you are, you then take that information and make the necessary lifestyle changes so that you won't end up with diabetes. And by the way, insulin resistance, which is what you're measuring, also is why you get hypertension. Oh, by the way, your risk for dementia is higher because of insulin resistance. Oh, by the way, your risk for a stroke is higher because of insulin resistance. Oh, by the way, your risk for cancer is higher because of insulin resistance, because cancer cells love sugar. That's why Dr. Terry Mason said, stay away from sugar. It's like it's the worst thing on the planet when taken in excess. So for all those folk out here, whether you're a man or a woman, this is your opportunity to pause for a moment in 2022. And if you haven't been to your doctor, you haven't had labs, this is the time to do it. And those labs may be a little preview into what's coming. The good news is everything I've just described is reversible if you get it in time. So let's not wait. Let's take advantage of that opportunity. So with that, we like to do something at Couch Conversations where we give our final thoughts, our takeaways, what message would we like to leave with everybody that's joined us this evening. So let's go ahead and get that started. And we'll go down to our buddy, Dr. Graham, again and see what Dr. Graham has to share.
Oh, come on. Let's go. Thanks, Tony. I've just been reflecting on tonight's discussions. I need to share with everyone on the panel that before I did my one specialty, I was really interested in cancer and did a couple of years in cancer treatment. And I just can't stress to you the importance of what Dr. Mason says, is that you want to catch this before you have symptoms. Because by the time you have symptoms, you're seeing someone like myself, and you're in for a really long and ugly road to hoe. And even though we talk about these uncomfortable exams, they're temporary and they're very short-lived. They're nothing like seeing the cancer specialist and dealing with that for the years to come. So this is really important and valuable. The discomfort is very short-lived, but the information will last for years and really help you and your family. So I just want to commend everyone for what they had to say tonight.
Thank you, Dr. Graham. Dr. Miller, what would be your final takeaways for tonight?
Well, I like to sort of address men. I mean, the issue of men's response to their health and preventative care was mentioned. Men in general, but Black men in particular, we seem to have a lot of issues with being concerned about our health and make sure that we are maintaining and doing the things that we need to do. I know, sometimes we grow up with this macho thing that, that we're going to be able to overcome anything. And if it ain't hurting, I shouldn't bother with it. But believe me, symptoms of diseases don't occur until the disease is usually pretty much advanced. So, there's be wise and use your wisdom in a good way to prevent yourself, or to find out if you have something early in life or early as the process begins, so that you may be able to do something to intervene that will stop the process and hopefully give you some long life to live afterward. And don't be afraid. I mean, I don't think we're afraid of doctors, but we need to utilize them in a better way. And if you're paying for health care, why would you, if you got, I mean, we oftentimes make certain that we go in for that usual servicing of our vehicles. How about your body? Let's get it serviced on a regular basis and take care of it. That's my until next week.
All right. Thank you, Dr. Miller. And Dr. Terry Mason, what would be your final takeaways for us tonight?
I want to pick up on what Dr. Miller just said, because I always said that men take better care of their cars than their bodies. They know when the oil needs to be changed. They know what the pressure needs to be. They know many of us know those of us who used to be a member of what I call the RRC, the Raggedy Ride Club, which I was before I had $1. But you knew about tire pressures. You knew about all the different things that the car needed and when it needed it. And so you always took it in to get it checked. And we did better care of taking care of our cars than we did our bodies. Mm-hmm. And to follow up on what Dr. Miller said, that's what we need to do, because you got to remember, there is no symptom of any disease in its earliest, most curable stage. So if you're waiting on a symptom, you are purposely setting yourself up to get caught with something late as opposed to something early. So advantage yourself of the early screening opportunities.
Thank you, Dr. Mason. Totally agree. Dr. and my brother, Dr. Pete, go ahead and share your final thoughts.
Yeah, just piggybacking off of my colleagues, I want to encourage our men to utilize technology, and that is there are several devices that you can use on your phones that will help you to track your steps, help you to track your sleep, and all of the things that help to reverse or to prevent inflammation. So movement is medicine. To move around is medicine. To be sedentary is hurting your body and feeding inflammation. So whatever you starve is going to stop growing. Whatever you feed is going to grow. And so we want the men to move. We want you to monitor your steps and just make sure, pick a number. I mean, people say 10,000 steps, but you start off with 5. Just say, I'm going to get to 5,000 steps. I don't care. People say, well, I'm a computer programmer and I sit down I don't care. Stand up and do your computer programming. Every 10 minutes, set your alarm and take a walk from one end of the house to the next end. The other thing in terms of technology is signing up for your portal for your doctor. So I think it's wonderful that you don't have to get on the phone and stay on the phone for 9 hours to get to somebody at your doctor's office. You can be on your phone, message your doctor. Hey, I just heard a group of doctors talk about fasting insulin levels. Can I get that? Can you check my PSA or lipid panel? You can do that right now on your phone through your portal. So if you don't know how to sign up for it, it's very easy. But if you don't know how to sign up for it, you can ask someone at your doctor's office. They will help you to sign up for it, and it's just super cool. It's kind of like texting one of your friends. So utilize technology. You got to love yourself. I know men, we care about producing and helping to support our family. You can't support nobody if you're not here. Okay, and you look at the loss of income by the amount of years that Black men leave here. That's tragic to our families and to our communities. So consider yourself going to the doctor like earning a paycheck. That's another job hustle for you.
Thank you, Brother Pete. Very inspiring, and totally agree. And I think I'm going to ask Nikki, the real host of the Couch Conversations, to introduce the congressman. But before we do that, I just want to give my final thoughts, and it's very simple. I have to go back to my foundation, which is metabolic health, and I will remind you over and over again that only 12% of Americans are metabolically healthy. Mm-hmm. Only 12%. So again, that means that only 12% have a normal blood pressure, normal blood sugar, a waist circumference that's less than 40 inches for men, 35 for women, have triglycerides that are normal, and have a good cholesterol called HDL that's normal. 12%. But guess what? 88% who are not unhealthy are at risk for heart attack, stroke, cancer, diabetes, and all those things I mentioned earlier. Mm-hmm. So you can't unlearn that. And so my goal is to help you understand that the secret to healing from metabolic dysfunction is to do lifestyle changes. That means that you have to move your body. You have to eat real food. You have to reduce stress. You have to get adequate sleep. You have to think in a way that's going to serve you more positively. You have to recover from trauma if you've been traumatized. You have to be in healthy relationships. You have to avoid harmful pollutants and organisms like COVID. And if you do all of those things, you will overcome this disease called metabolic syndrome. So my wish for you today is to figure out, where do you have gaps? Where are you struggling? Where do you need to improve? And start working on that immediately. But do what Brother Pete said. Go get on your portal or call your doctor if you're not savvy to that, and say, I need to come in and get get my labs checked. I want to know where I am because 2022 is going to be my year. And with that, I introduce Nikki Harvey to kind of close us out. Nikki, it's your floor.
That's so sweet of you, but I'm going to give it to our real host, and that's you guys. And to Dr. Pete and Dr. Terry Mason, I'm going to let you guys introduce the congressman. Pete has been our host since the beginning, so I'm going to let him do that. But one thing I know that we do want to remind you guys of, I know we had our men's health, and I think that was great that we shared that tonight, and people began to chime in and share. But we want to remind you that Miss Rona is still here. That's right. The coronavirus is still here. Miss Rona is still here. Don't be fooled. Do not be fooled by her. We want to make sure that you get vaccinated, get your boosters, and remember to do what? Social distance. Wash those hands really good. Don't forget to get in here when you wash those hands. And most of all, those droplets are what are dangerous. So wear that mask. Make sure that you wear your mask over your nose and mouth, not on your forehead, but over your nose and your mouth. And they have cute N95 now. So if you wear glasses like I do, they won't even fog up if you put your glasses on top. So we want you guys to make sure that, remember, Miss Rona is still here. Don't be fooled by her. She's just lurking around. She is the thief in the night. So pay attention to what she's doing. Dr. Pete, take it away.
Yeah, I just want to introduce the vanguard of health, who's been on the front lines and fighting for the community to make sure that we have access to affordable health care. And he does all the dirty work and stays up late and from airport to airport and, fighting for people who can't fight for themselves. And he is a good member of the greatest fraternity of all time, Alpha Phi Alpha Fraternity Incorporated. And that is Brother Danny Davis. And Terry, you want to comment? Just bring in something?
No, I think you've said it all. I think that one of the things I will say is that I owe my career to the work that Dr. Danny K. Davis has done. Had it not been for his advocacy at the University of Illinois, way before I came there, and the advocacy that he was able to effectuate with the other folks on the West Side, Mrs. Nancy Jefferson and other folks that Danny will remember, I'm grateful for the shoulders that I stand on. And I'm grateful to you, Dr. Davis, for making that possible. And may God continue to bless you with a longer and profitable and helpful life.
Well, I tell you, with all of that, let me say, I thank all of you for the wisdom that you continue to impart. One of my friends said the other day, of course, he's a blues singer, and since we're talking about men's health, he said he was born on the 7th month, the 7th hour, and the 7th day. And he heard 7 doctors say that he was born for good luck. And don't you see, I'm a bad man. Don't you mess with me. So in the words of the blues singer, he said, these some bad men. and of course, Nikki, you fit right in with the group. Well, let me tell you, I was wondering the other day, I wonder if Chinese people get cold. Because I went to the Chinese New Year's parade Sunday, and the mayor was there, and the governor was there, and we was shivering and going on. And about 5,000 Chinese citizens there, up and down Whitworth. And we had a long program as well as a long parade. And we just had ourselves a good time. They didn't even have any Chinese tea out there, nothing. And so we're just ushering in the new year. And I'm saying, I wonder, can you get that many black folks at the Bud Billiken parade, even in the summertime? But it was a great, tremendous weekend. I did have one question, Dr. Mason. I was just thinking, if you increase your risk factor 18% with one hot dog, what about a Polish sausage?
All I can say, Congressman, is that's bigger than a hot dog.
Well, I was just wondering if the Polish went up.
That I don't have the data on that. They looked at hot dogs. They didn't look at Polish shit.
So they just went on. But the information has been tremendous, and I have been truly inspired to listen and to understand and to hear all of the enlightenment that people can pick up. And education is supposed to be not just something that you know, but something that you do. And I'm saying, as a result of that, there are people who've been educated who don't smoke cigarettes anymore. I mean, they really, I know a whole bunch of people who don't smoke cigarettes anymore, who used to smoke cigarettes. I used to smoke cigarettes. I could blow smoke rings all around and smoke through other smokes. And not only did I have cigarettes, I had pipes and the whole thing. And I spent money buying them that I don't spend anymore on cigarettes. I buy them on something. And a little bird was telling me that, notwithstanding what these doctors say, I still call my sugar candy. And I'm sweet on candy. And candy is sweet on me. So my understanding candy. Today is Valentine's Day. Have yourselves a wonderful, wonderful Valentine evening. And I got some sugar-free candy kisses that if I was close enough, I'd give to you all. So thank you very much. Have a wonderful evening, and we'll see you next week.
Thank you, Congressman.
All right. Have a great night, guys. Thank you.
I got a mojo too.